Whittier Street Health Center has served the community for more than 8 decades. The Roxbury facility serves everyone, regardless of insurance coverage or ability to pay. The health center offers primary care, wellness programs, behavioral health services, and more. Joining me now is the center's president and CEO, Frederica Williams. Thank you so much for being here.
Thank you for having me. It's wonderful to be here.
Oh, I'm excited to have this conversation with you. Earlier in the show, we talked a lot about the inequities that Boston's Black communities face. You've been doing this for a long time.
Yes.
How do you see these disparities every day?
So earlier the commissioner spoke about the systemic issues. We have a mission statement that aspires to be a center of excellence that addresses health equity, social justice, and the economic well-being of our patients. So when we look at health issues, the issues that are prevalent in the community, whether it's cancer, cardiovascular disease, diabetes, we have a high rate of prevalence. But we also have to look at the social determinants of health and look at the systemic issues. And the reason we've been consistent is because our work is informed by the community. Instead of talking at them, we engage them so we can educate them, empower them, and engage them and activate them in taking care. So we could all get overwhelmed, and we're seeing changes. So when I started really looking at the health outcomes, looking at the data provided by the Boston Public Health Commission, the life expectancy gap in Roxbury was 33 years. Now it's narrowed to 23 compared to the Back Bay. That's still unacceptable, but we need to continue to be focused on creating equitable access for our patients so they too can live a good quality of life. So they too, especially at a time when people are struggling with affordability. So what we've done is created a holistic approach, looking at engaging the community, removing barriers. Transportation is a barrier, housing is a barrier. We have a food pantry, teaching kitchen, where we teach people to be healthy. So it's looking at the systemic issues, being advocates for the community, but also learning from the community. Our patients really know what works. So rather than judging and making judgments about individual lifestyle, we look at how can we look at the systemic barriers, remove them, and engage our patients.
Really important. Speaking of engaging patients, I know since the pandemic, you've really been trying to re-engage people. How are you making it easier for people to prioritize their health?
It is understanding that before the pandemic, there were issues that were there, and the pandemic exacerbated those issues that were already there. Mental health is a stigma in our community. Wellness and prevention. It isn't that people do not want to focus on their health. Taking time off from work sometimes, I can take time off and go to the doctor and not lose my paycheck, but if you're an hourly employee and you're on a fixed income, that in itself is a barrier. So it is really, we are patient and community centered. It is creating opportunities. Our clinics are opened from 8 o'clock in the morning to 8:30 at night, and on Saturdays. And we also go into the community. We have community health workers. What makes the difference is when you have people from the community that have the lived experiences, that live in the community. We have people who live in public housing developments that we call social health coordinators. They are advocates, but they also give us the information. One thing that we do that's different is each year we do a community needs assessment where we survey more than 2,000 people. That helps to inform our work and understanding what barriers we need. We have a satellite clinic on Blue Hill Ave. We have a main site on Tremont Street. But we're in schools, we're in housing developments. We have a fleet of 5 mobile vans where we're providing dental, eye care. So it's really meeting people where they are, removing these barriers, and also being there as a long-term sustainable. When patients know you'll be there for them, then they can trust you. They trust us.
That's key. Trust is
Trust is
key.
key. And one of the things we're trying to also engage, working with the biotech. Boston, Massachusetts has a big biotech industry, but our community is cut out of it. So we've established our Center for Health Equity Research. We're working with biotech organizations such as Vertex to bring clinical trials, because remember that our patients, lack the trust. There's mistrust of being used as guinea pigs.
Yeah.
But if it's Whittier Street Health Center that's working, so we look at the data, we look at the information the community is giving us. We create programs that are culturally sensitive. We have 25 different languages spoken. Our focus is on the low-income population, but also on minorities. And as a role model, I'm looking for future CEO in our patient population. So it's creating internships for Boston Public School students. So healthcare is a secure industry to be in.
Absolutely.
So they're future doctors and nurses, but actually seeing that role model and mentorship is what would make them feel empowered. And that's really the cultural competency, the education is how we will be able to close the barriers.
Excellent. I know coming up here, I do want to talk about this on June 27.
Yes.
Whittier Street Health Center will host its annual Men's Health Summit.
Yes.
You've held this summit for a long time, 27 years. How has that, though, consistency, encouraged men to care about their well-being? Because that's really important to kind of remove stigma and make sure that they are also, showing up and getting their healthcare needs
But
met.
it's also not being judgmental.
Right.
So making this blanket statement about men don't like to go to the hospitals or stoicism and all those rest of the issues, it's creating an opportunity where men feel open, listening to other men. But most times, too, the summits are well attended by the women and the children. So it is a healthier man is a healthier family, and that's a healthier community. And we've stayed consistent. I will tell you that when we started, we were actually looking at data, is how we develop our programs. Our male patient population were in the single digits. Now, 49% of our patients are men.
Wow.
So we've engaged them, but I'm still amazed that every year that we're doing the summit, I've done it for 25 years, men are still finding about it for the first time. So our work is not done.
Right.
It's that consistency, it's that sustainability, it's that commitment. Many times for our patients, their community health center is the one stable force that's in their life that they know, understands them, advocates for them, looks at policy changes, bring issues to elected officials, and help them to be engaged in their care.
We really appreciate the work that you're doing. We're going to put that details about that event on our website, WCVB.com. Frederica
And we
Williams.
encourage all men to attend, and their families, and we're focused on boys as well.
There you go. Thank you so much, Frederica. We really appreciate it.
Thank you.
And thank you so much for watching CityLine. CityLine is about the stories that shape our communities, and we want to hear yours. Share what's happening where you live at CityLine at WCVB.com. Have a great afternoon.